What are the 6 functions of Viagra in our health? Viagra is a brand name for sildenafil, a medication that is primarily used to treat erectile dysfunction, ED, in men. Erectile dysfunction is a condition where a man has difficulty achieving or maintaining an erection sufficient for sexual activity. Viagra belongs to a class of medications known as phosphodiesterase type 5, PDE5, inhibitors. The drug works by inhibiting the enzyme phosphodiesterase type 5, which plays a role in regulating blood flow to the penis. By blocking this enzyme, Viagra helps increase blood flow to the penis, which can result in improved erectile function. It's important to note that Viagra does not cause an erection on its own. Sexual stimulation is still necessary for the medication to be effective. Additionally, Viagra should be taken under the supervision of a healthcare professional, as it may have potential side effects and interactions with other medications. It's always essential to consult with a healthcare provider before starting any new medication to ensure it is safe and appropriate for your specific health condition. Viagra, sildenafil, is primarily prescribed to address erectile dysfunction in men, and its main function is related to improving blood flow to the penis. The key functions of Viagra in our health are: the treatment of erectile dysfunction, ED, often involves addressing underlying causes and using medications or other interventions to improve sexual function. Viagra, sildenafil, is one of the medications commonly prescribed for the treatment of ED. Here's how Viagra works in the context of treating ED. Phosphodiesterase inhibition. Viagra is a phosphodiesterase type 5, PDE5, inhibitor. PDE5 is an enzyme that plays a role in regulating blood flow to the penis. By inhibiting PDE5, Viagra helps increase the levels of cyclic guanosine monophosphate, CGMP, a chemical that promotes relaxation of smooth muscles and dilation of blood vessels in the penis. Smooth muscle relaxation. The inhibition of PDE5 by Viagra leads to the relaxation of smooth muscle cells in the blood vessels of the penis. This relaxation allows increased blood flow to the erectile tissue, resulting in an improved ability to achieve and maintain an erection when sexually stimulated. Enhanced nitric oxide pathway. Nitric oxide, NO, is a signaling molecule that plays a crucial role in the dilation of blood vessels. Viagra enhances the effects of NO by preventing its breakdown, leading to increased vasodilation and improved blood flow to the penis. On-demand use. Viagra is typically taken as needed, about 30 minutes to an hour before sexual activity. It is not an aphrodisiac and does not cause an automatic erection. Sexual arousal and stimulation are still necessary for it to be effective. Duration of action. The effects of Viagra usually last for about 4 to 6 hours, allowing for a window of time during which a man can achieve and sustain an erection in response to sexual stimulation. It's important to note that while Viagra is a widely prescribed and effective treatment for ED, it may not be suitable for everyone. Individuals with certain medical conditions or those taking specific medications should consult with their healthcare provider before using Viagra. Additionally, lifestyle factors such as diet, exercise, and overall health play a role in the management of ED, and addressing these aspects may be part of a comprehensive treatment plan. Always seek guidance from a healthcare professional to determine the most appropriate approach for your specific situation.
Pulmonary arterial hypertension, PAH, is a serious condition characterized by high blood pressure in the arteries that supply blood to the lungs. It can lead to various symptoms, such as shortness of breath, fatigue, chest pain, and dizziness. PAH can be a result of different underlying causes, and it often leads to an increased workload on the right side of the heart, which can eventually lead to heart failure. Viagra, or sildenafil, is one of the medications approved for the treatment of pulmonary arterial hypertension. Here's how Viagra is used in the context of PAH. Vasodilation. Similar to its action in treating erectile dysfunction, Viagra works by inhibiting the enzyme phosphodiesterase type 5, PDE5. This inhibition leads to increased levels of cyclic guanosine monophosphate, CGMP, which promotes the relaxation of smooth muscle cells in the blood vessels. In the case of PAH, this vasodilation effect helps to relax and widen the pulmonary arteries, reducing the resistance to blood flow and lowering pulmonary blood pressure. Reduced right ventricular workload. By dilating the pulmonary arteries and reducing pressure, Viagra helps decrease the workload on the right side of the heart. This is important in PAH, where the right ventricle of the heart is often strained due to increased resistance in the pulmonary circulation. Improved exercise capacity. Treatment with Viagra in PAH patients has been associated with improvements in exercise capacity. This can be beneficial for individuals with PAH who may experience limitations in physical activities due to reduced lung and heart function. Chronic treatment. Unlike its on-demand use in erectile dysfunction, Viagra is typically used as a chronic treatment for PAH. Regular use, as prescribed by a healthcare professional, helps maintain its beneficial effects on pulmonary blood pressure and exercise capacity over time. It's crucial to note that the use of Viagra for PAH should be under the guidance and supervision of a healthcare provider. Additionally, there are other medications specifically approved for the treatment of PAH, and the choice of medication depends on the individual's specific condition, medical history, and overall health. As with any medication, potential risks and benefits should be discussed with a healthcare professional. In the context of pulmonary arterial hypertension, PAH, improved exercise capacity refers to the ability of individuals with PAH to engage in physical activities with reduced limitations. PAH is a condition characterized by high blood pressure in the arteries that supply blood to the lungs, leading to increased resistance in the pulmonary circulation. This increased resistance can result in symptoms such as shortness of breath, fatigue, and reduced exercise tolerance. Viagra, sildenafil, has been shown to have a positive impact on exercise capacity in some individuals with PAH. The vasodilatory effects of Viagra contribute to the relaxation of smooth muscle cells in the pulmonary arteries, reducing the resistance to blood flow. This, in turn, allows for improved blood flow to the lungs and can enhance the ability of the heart to pump blood more efficiently. Several clinical studies have demonstrated that Viagra can lead to increased exercise capacity in patients with PAH. The improved exercise tolerance can be measured through various parameters, such as the distance walked during a 6-minute walk test, which is a common method used to assess functional capacity in individuals with cardiovascular and pulmonary conditions. By reducing pulmonary arterial pressure and easing the workload on the right side of the heart, Viagra helps individuals with PAH experience less exertional dyspnea, shortness of breath, and fatigue during physical activity. This improvement in exercise capacity is significant for enhancing the quality of life for those living with PAH, as it allows for a more active and less restricted lifestyle. It's important to note that while Viagra has demonstrated benefits in improving exercise capacity in PAH, it is just one of several medications approved for the treatment of this condition. The choice of medication and treatment plan should be individualized based on the specific needs and characteristics of each patient, and healthcare professionals play a crucial role in guiding and monitoring the use of these medications. As with any medical treatment, potential risks and benefits should be discussed with a healthcare provider. Raynaud's phenomenon is a condition that affects blood flow, usually to the fingers and toes, and occasionally to the nose, ears, nipples, and knees, in response to cold or stress. During an episode of Raynaud's, the affected areas may turn white or blue and feel cold and numb until circulation improves, at which point they often turn red and may throb or tingle. The treatment of Raynaud's phenomenon focuses on managing symptoms, preventing episodes, and addressing underlying causes. While Viagra, sildenafil, is not the first-line treatment for Raynaud's phenomenon, it has been studied and, in some cases, prescribed for individuals with severe or resistant symptoms. Here's how Viagra may be used in the treatment of Raynaud's phenomenon. Vasodilation. Similar to its use in other conditions, Viagra works by inhibiting the enzyme phosphodiesterase type 5, PDE5, leading to increased levels of cyclic guanosine monophosphate, cGMP. This results in the relaxation of smooth muscle cells and blood vessels and vasodilation. In the context of Raynaud's phenomenon, vasodilation can help improve blood flow to the affected areas and reduce the severity and frequency of vasospastic episodes. Reduced frequency and duration of episodes. By improving blood flow, Viagra may help decrease the frequency and duration of vasospastic episodes in individuals with Raynaud's phenomenon. This can be particularly beneficial for those who experience severe symptoms or do not respond well to other treatments. Underlying mechanisms. While the exact mechanisms underlying Raynaud's phenomenon can vary, it is often associated with abnormal blood vessel responses to cold or stress. The vasodilatory effects of Viagra may counteract these abnormal responses and provide relief. It's important to note that the use of Viagra for Raynaud's phenomenon is not universally accepted, and its effectiveness can vary from person to person. Additionally, healthcare providers may consider other medications, lifestyle modifications, such as keeping warm and managing stress, and, in some cases, addressing underlying conditions contributing to Raynaud's. If you have Raynaud's phenomenon, it's crucial to consult with a healthcare professional for a thorough evaluation and appropriate management plan. Treatment decisions will depend on the severity of symptoms, individual health factors, and the specific characteristics of the condition. Research on the potential applications of Viagra, sildenafil, for various health conditions beyond its primary uses in erectile dysfunction, ED, and pulmonary arterial hypertension, PAH, is ongoing. While Viagra's main mechanisms of action involve vasodilation and improving blood flow, researchers are exploring its potential benefits in different medical contexts. It's important to note that these potential uses are still under investigation, and more research is needed to establish their efficacy and safety. Some areas of research include heart disease. There is ongoing research to explore the effects of PDE5 inhibitors like Viagra in conditions such as heart failure. The vasodilatory effects of these medications may have potential benefits for individuals with certain types of heart disease. However, this area of research is complex, and results have been mixed. Raynaud's phenomenon. As mentioned earlier, Viagra has been studied for its potential benefits in managing Raynaud's phenomenon, a condition characterized by reduced blood flow to extremities in response to cold or stress. Neurodegenerative disorders. Some studies have investigated the potential neuroprotective effects of PDE5 inhibitors, including Viagra, in conditions such as Alzheimer's disease and Parkinson's disease. The idea is that improved blood flow and vasodilation might have positive effects on brain function and neuroprotection. Altitude sickness. Research has explored the use of Viagra for preventing and treating symptoms of altitude sickness, particularly high-altitude pulmonary edema, HAPE. The vasodilatory effects of Viagra may help improve oxygen delivery in low-oxygen environments. It's crucial to emphasize that while these areas of research show promise, using Viagra or similar medications for conditions beyond their approved indications should only be done under the guidance of a healthcare professional. Additionally, potential risks and side effects need to be carefully considered. As the field of medical research evolves, new findings may emerge, and the potential uses of medications like Viagra may be further elucidated. Individuals interested in the latest research developments should consult reputable medical sources or speak with healthcare professionals for the most up-to-date information. Altitude sickness, also known as acute mountain sickness, AMS, can occur when individuals ascend to high altitudes, typically above 8,000 feet, 2,400 meters, or more. It is caused by the body's difficulty in adjusting to the lower oxygen levels at higher elevations. Symptoms of altitude sickness can include headache, dizziness, nausea, and fatigue. Research has suggested that phosphodiesterase type 5, PDE5, inhibitors, such as Viagra, sildenafil, may have a role in preventing and alleviating symptoms of altitude sickness, particularly high-altitude pulmonary edema, HAPE. HAPE is a severe form of altitude sickness that involves fluid accumulation in the lungs. Here's how Viagra might be involved in altitude sickness prevention. Vasodilation. Viagra's primary mechanism of action is the inhibition of PDE5, leading to increased levels of cyclic guanosine monophosphate, cGMP. This results in the relaxation of smooth muscle cells and blood vessels and vasodilation. In high-altitude environments, increased blood flow to the lungs may help improve oxygenation. Reduced pulmonary artery pressure. By relaxing the smooth muscles in the pulmonary arteries, Viagra may reduce the pressure in the pulmonary circulation. This effect can be particularly relevant at high altitudes, where the reduced oxygen levels can lead to increased pulmonary artery pressure. Several studies have investigated the potential benefits of Viagra in preventing altitude sickness, especially HAPE. However, the results have been mixed, and more research is needed to establish the efficacy, safety, and appropriate dosages for this use. It's important to note that using Viagra or any medication for altitude sickness prevention should be done under the guidance of a healthcare professional. Altitude sickness can be a serious condition, and preventive measures, such as gradual acclimatization and staying well hydrated, are essential. Individuals planning to travel to high-altitude areas should consult with a healthcare provider to discuss potential preventive strategies and medications based on their health status and specific travel plans. It's important to note that while Viagra has these potential benefits, its use should always be prescribed and monitored by a healthcare professional. Additionally, the efficacy and safety of Viagra for conditions beyond ED and PAH are still areas of ongoing research and are not yet widely accepted as standard medical practices.